And up next, another important issue that Dr. Audrey Klenke from Pinnacle Plastic Surgery is going to address, skin cancer detection. Welcome, doctor.
Thank you.
Glad you're here. Now, what is the most important advice for detecting skin cancers early?
The most important thing to detect skin cancers is for you to look at your body. So about once a month, really, people should be standing in the mirror and kind of trying to see as many angles as they can, looking for things that are changing, and we'll talk about that. If you have a spouse or a friend who can look at hard to reach places, hard to see places.
Right.
But then you should also be looked over by a skincare provider. So either a plastic surgeon or a dermatologist who can also sort of look in all the nooks and crannies and look for things that are changing, take photos, and be able to compare those from the last time you were in.
Yes. Now, as a plastic surgeon, do you offer skin checks and biopsy removal of irregular lesions?
Yes, absolutely. I have a lot of patients that come in that are concerned about spots or things that don't seem right or itch or bleed, and I do perform biopsies in the office. So yeah, we are definitely the full skin care provider.
Now, speaking of detection, how do you know what to look for? I heard there are some ABCs of skin cancer. Tell us about that.
Yes, that is the easiest way to break it down in your mind. So the A, B, C, D, and now it's E's of skin cancer. A is for asymmetry. So you're looking at your spot, and if you were to split it down the middle, it should look the same on one side as it does on the other. B is for borders. So you're looking at the edge of your spot, and it really should be a crisp, clean border and not irregular or sort of scalloped or funny looking along the edges. C is for color, and not necessarily just that it's dark, but color variation within the same spot. So if you see that it's light brown in one area and dark brown in the other, that can sort of be a reason to have a biopsy. D is diameter. So you want something that is over about the eraser on a pencil tip, so 6 millimeters. Anything that's larger than that really should probably be biopsied. And the last one is E. E is the newest member, and it stands for evolution. So if you notice that a spot is changing, it's grown, it looks different than it looked before, it's itching, that's a reason to have something biopsied as well.
Gotcha. Now, are there any topical creams that are clinically proven to help treat precancerous lesions?
Yes, actually there are lots of topical options, and the precancerous lesions that we're talking about, they're called actinic keratoses. So there are things that are from the sun, and if you leave them long enough, sometimes they can become a skin cancer. So you're trying to catch them before they reach that stage and treat them early. So the topicals, for example, Picato is the newest member on the block, and that one you only have to use for 2 or 3 days depending on where on the body your spot is. There are some other creams and topicals, you just have to use them longer. So it's really about me finding something that's best for your lifestyle and working with your insurance plan too.
Yes, exactly. Well, we are just about out of time. Thank you so much, Dr. Klenke.
You're welcome. Thank you.
And don't go anywhere. We still have more for you. Shelley West was out and about at the Miss Bluffton High Tea right after the break.